Good afternoon, everyone. I am Laverne Bowen, and we are here at BronxNet Television Studios. And you know us, we're JLP's Youth Talk. However, today, Julia Lynn Productions, Inc. is bringing you some amazing information on an incredible topic. The topic of today's show, childbirth, realities, misconceptions, and alternatives. I have an extremely esteemed panel, and I'm so happy to introduce them all to you. I'm going to go around the room and give you a little bit bio information about these incredible women, and we're going to then discuss today's topic. We're going to start with a fabulous woman on my left. Her name is Janice Hackney. Janice Hackney is an OB/GYN perinatal nurse working at Montefiore since 1994. Previous work locations include St. Luke's Roosevelt Hospital and North Central Bronx Hospital. Janice has a BS in nursing from Lehman College, right here in the Bronx. And she is a Lamaze certified childbirth educator and a member of the Childbirth Education Association and the New York State Nursing Association. Let's welcome Janice to our show.
Thank you.
Thank you.
Thank
Welcome,
you.
Janice. We also have Umaima Mahmood Cham. Umaima is a New York State licensed midwife certified by the American Midwifery Certification Board, that's the AMCB. She began as a doula in 1998 and has worked as a full scope midwife since 2004, beginning with home birth. Umaima works with women from diverse socioeconomic backgrounds and has had the pleasure of attending over 800 births to date. 800! God bless. Welcome, Umaima. Wow. And now we have Miss Kachina Ukuya Randall. Did I say it right? Akuya. Kachina Akuya Randall. Such incredible ladies, huh? Kachina is a certified birth and postpartum doula, community activist, and part of a NGO called Voices of African Mothers. Currently, Kachina is overseeing the development of a girls' academy in the Volta region of Ghana, West Africa. When not working, Kachina enjoys spending her time with her two children, Yumina and Cairo, and her husband. Welcome, Kachina. Wow. And we have the lovely Kaylee Schuschner. Kaylee is here with us, and she's a new mom of a beautiful 10-week-old baby boy named Zaire. And she has had a home birth just this past January with a midwife, her husband, mother, and doula. Since Kaylee's water birth experience, she has been passing on the knowledge she received from her doula about pregnancy and birth to other expectant mothers in the hopes of contributing to positive birth experiences. Welcome, Miss Kaylee. Welcome, Kaylee. And ladies and gentlemen, last but not least, we have the powerful young lady who helped put this whole program together, and her name is Nubia Earth Martin. Nubia Earth Martin is a certified childbirth educator, birth and postpartum doula, a lactation counselor, and student midwife. In 2008, she created Birth from the Earth, which offers birth-related services to women and families in Yonkers, New York, as well as the surrounding boroughs. Nubia and her husband Bentley have 5 children, 2 born in the hospital, and the last 3 born at home with her midwife. Let's welcome the fabulous Nubia Earth Martin to this conversation. Ladies and gentlemen, I have to tell you, this is going to be an amazing conversation. The bios that I have just read are about incredible women helping in an area that we don't often talk about. And so we're going to begin this discussion. Again, this topic is childbirth, the realities, the misconceptions, and then the alternatives. So why don't we begin, because we have a lot to cover. So let's talk about birth. There are many terms and definitions about birth. So let's simplify things and get a general understanding about it before we begin. And so why don't we start with, what is a childbirth educator? Ladies, Janice, can you help us with that? What is a childbirth educator?
A childbirth educator is someone who teaches the expectant mother and her partner what to expect during pregnancy, birth, and the first few weeks thereafter. She also imparts knowledge so that the patient can be more familiar with birth terms and literacy, so that she can communicate more effectively with her provider, and be comfortable with the whole birthing process.
And it's so important for our pregnant, expectant mothers
Yes.
to be comfortable, isn't it?
Yes.
Excellent. So that's a childbirth educator. And now a doula. I tell you, I never knew really what a doula was myself. So what exactly, ladies, is a doula?
Well, a doula is somebody who provides support to the expectant mom during pregnancy, all the way up to the birth, and then immediately postpartum. So we answer questions, we provide emotional support, physical support during the birth. But really, I mean, I feel my role as a doula is to provide factual information so that my clients can make informed decisions. So, you know, hospital birth may not be for everybody, home birth may not be for everybody, but once you give somebody information, they can decide where the best setting is for them, the type of birth they like to have, who they want to have present at their birth. So that's pretty much what a doula does. We provide support in many different facets to promote a positive birth experience.
And actually, we know that there are some people, I didn't know, who were actually doulas that we may not know. I heard Erykah Badu is a doula. Did you know that? I didn't know who are some of the other doulas that we may not know. We can certainly look that up, but that is
And
a
I
doula.
know a lot of celebrities have, you know, been having their babies at home too. So that also gives voice and credibility to the fact that home birth is a safe option for a place to birth. Yeah.
Exactly. What a wonderful option. And when you talked a little bit more about what a doula does, but there are benefits to
Right.
having a doula
Yes.
versus a home birth. Katrina, can you tell us a little bit, what are some of the benefits of having a doula assist you in a birth?
Some of the benefits, there's a lot of benefits. One of the things that I like to think about is, personally, when I look at why I came upon, you know, this role in becoming a doula, I think about the companionship and how big of a deal that is. We know that, and studies can prove as well, that when you have someone that's there for you during this journey that you're on, it lowers so much of the unknown that causes stress, and, you know, raises your blood pressure, and it does so many things to your hormones that can, you know, postpone the arrival of the little one. And so what happens is that you have somebody that you know is there for you, in your corner, there to support you. And that automatically speaks to your spirit.
Yes.
You know, it speaks to the comfort level of where you're going to be on this journey, because you know, as I often like to say, your sisters can go with you to the bridge, but we can't cross the bridge
That's
with
right.
you.
That's right.
But we'll be there on the other side, and we'll be there to walk you there. But just knowing that, there's so much power in that. And you'd be surprised how many women do not have a a good circle of sistership.
Mhm.
That's
Exactly.
incredibly true. I mean, so now doulas are not new. So it goes way back in history, doesn't
Right.
it, Nubia? I mean, even though we are speaking about it now, and many people don't know about it. I have a 31-year-old son. I never heard about a doula. If I only knew. So can you tell us a little about the history
Yeah, I
of doulas in our past?
Yeah, I think, when you look at, the history of birth, there were always a group of women who kind of surrounded, like a village of support. And I would think sometime, when birth moved into the hospitals and it was limited how many people you can have in the room, that might have kind of taken away from that support system. How many people do you want to have at your birth? If, hospital regulations limit that, then you kind of lose a little bit, of your village. So the fact that people now know they have a choice, they can, when they're touring a hospital, ask, can I have my birth, partner there? Can I have my husband and my birth partner there? Can I have my husband, birth partner, and my mother there? And these are things that kind of bring it back to the roots where we knew a village kind of supports, the birth. And Kaylee can talk a little bit about some of the benefits of having, a doula there from a personal standpoint as well.
Kaylee, absolutely. Can you piggyback off of that? How was it in the sense of having a doula present at your birth?
It was amazing. Nubia showed up probably like an hour and a half after I went into labor. And then my mom showed up maybe like 45 minutes later. And it helped me stay relaxed, knowing that I had someone to help me through my contractions and, keep telling me to relax and to breathe and to just, let the contractions happen and just let my body do what it's doing. I honestly don't know what my process would have been like if Nubia wasn't there.
Wow.
Yeah, I mean, like, my mother and I wouldn't stop talking about her for like 2 weeks.
So it was
amazing.
a family decision that you came upon in selecting a doula versus, we're going to get into the different types of assistance, but you sought out a doula instead of a normal hospital birth?
Yeah. I first had midwives that were hospital midwives, but I knew that what I really wanted was to have a home birth. I really wanted to have a water birth. So probably my second or third time going into my hospital midwives, I didn't feel taken care of the way that I wanted to feel taken care of. So I immediately went home and I started looking up midwives and doulas that my insurance could afford or that we could afford out of pocket.
Oh, wow.
And
So
that's
we're going to get into that in a minute. That is very important. But you brought up a good point about midwives, and we would like to know exactly what a midwife is. So we talked about doula and Omima.
Yes.
Can you tell us what exactly is a midwife?
Sure. So a midwife, traditionally, a midwife is a woman who is with woman during her childbearing years. I am a licensed provider. I am a primary care provider, a medical professional who walks with woman through her childbearing years. Midwives function in different settings. I happen to be a home birth midwife. And as a home birth midwife, as you were saying, Kachina, the importance of building that relationship, that companionship, I am able to do in the home setting with my families. That's paramount, really, to having a successful, safe, healthy birth. Pregnancy, birth, and postpartum.
That was so important. So wait, let me make sure I understand this. So a midwife literally walks a woman through from what, day one, so to speak, throughout the whole birth?
Okay, so when it comes to women's health in general, midwives care for women from adolescence until as medical providers, but we are so much more than just the medical providers. Our type of care is more holistic. So at home, what that looks like is, yes, from the very beginning, a woman will seek me out for her care. I come to her home, and from day one, I'm assessing really what her needs are. The care is very individualized. It's not, it's very different from an institutional setting because I have the time to do it. The visits are 1 hour long. We're building relationship. I'm listening to what her needs are, and I serve as a sort of, to not really depersonify, my role, but I'm a toolbox, really, to provide her what it is that she needs.
Well, I just have one question. Where were you like 31 years ago when I, because, I was on my way to the regular hospital. And so my questions, ladies, is how on earth, I mean, we as regular women, as Kaylee sought out a midwife and doula, but how do we find a midwife and doula? Now, I heard about birthing centers and such.
I just want to speak on what you were just
Absolutely. Go
asking.
ahead, Nubia.
Umaima was my, midwife for my youngest.
Oh, so
Yes.
it's just all the village here.
With my first two, I had hospital births, and I knew after those two births, this cannot be the only way. It just wasn't for me.
Can you explain a little bit about your experience as to why?
Just in brief.
Why you chose an alternative route?
Sure. Yeah, just briefly. With my first two, I knew I wanted to have birth, naturally, unmedicated, vaginal birth. And I was able to, but I felt that the hospital was constantly, are you sure you don't want pain medication? Are you sure you're going to be here for a long time? And just trying to kind of plant seeds of doubt in my head. And luckily, I had done a lot of reading on my own, but I could imagine if somebody didn't come in there armed with that information, it would be easy in a vulnerable moment in the height of a contraction if someone says, are you sure this is the way you want to go? You might say, no, somebody saved me. You might think that you need to be saved rather than understanding that this is how the process unfolds and you need to kind of surrender to it. So I just knew that after those first two, I definitely wanted to seek an alternate option. And just, it's the continuity of care, that Umaima was just speaking about. It's a midwife coming to you and seeing what it is you need for your birth. And I know for mine, even though it's my fifth, you still need support. You still need somebody right in your ear telling you you're doing an amazing job. You still need somebody to kind of making that eye connection at the height of a contraction when you get to that rock and hard place of, oh my God, can I do this? Can I really, cross that bridge that Katrina was speaking about?
Well, ladies, this is really, to some women, it'll be revolutionary information.
Absolutely.
I know it was for me, but Janice, can we speak upon our regular way of going to a hospital? It's sort of the norm, for us to just automatically go to a hospital. So there's some benefits, no? Are there?
In the hospital, yes. Some people want the comfort of knowing that they are cared for by a team, whether it's the nurse, it's the emergency personnel regarding baby in case anything goes wrong with the baby.
Do I say the drugs?
Exactly, the medication, exactly. And that is all incited with the fear of the labor pain that they're having. There lies the miseducation that women come into, which in my class that I teach at Montefiore, the first thing I start talking about is fear. What are your fears and how do you deal with pain, period? And it's an array of responses you get. Some say, oh God, if I have a hangnail, I'm going to take a Tylenol. Whereas some say, I have a strong sense of pain tolerance. And I let them know that there's no right or wrong. It's how you are. And then explain to them that pain has a purpose.
Right.
And so I start right there so that they know that the pain that they're experiencing has a specific purpose in their whole labor process.
Excellent. So these classes are at Montefiore
Yes, the
Hospital
classes
now.
are at Montefiore.
You teach.
Yes, on Saturdays that I teach at the Weiler site.
Excellent.
And it's pretty well attended, and a lot of the staff, the clientele who come are very appreciative, because a lot of them don't get the information and they don't know some of the things before going to the labor floor and having their birth experience. So as Nubia talked about, in terms of having an informed decision, do I want a home birth, do I want a hospital birth, do I want a water birth? There's so many different things a woman can choose from.
Absolutely. So
which is good,
it's a wonderful thing to know. So
Exactly.
going along, you Mayma, you wanted
Yes,
to
there are you can find midwives also in hospital.
Yes.
Yes.
In the
clinic
hospitals. Yes, you
setting.
spoke about
Absolutely.
Yeah,
hospital
I first had
midwives.
hospital midwives.
So now,
Yes.
how do we know that? I'm telling you, I had my son in the hospital. I didn't know there was a midwife around.
Sure.
I mean,
So there
should
are-
I what? Just ask the nurse? Nurse, is there a midwife around? What do we do?
So you in just about every neighborhood in New York City, you should be able to find a hospital that has midwives as
Excellent.
staff. Okay. So
So you have to do your due diligence.
You do have to do your
and
due
find out.
diligence if they are not, reaching out. Generally, hospitals with midwifery service do reach out to the communities. So the communities generally tend to know if the midwives are there. Okay. So that is a kind of care in hospital, to me, that is closer to what a home birth midwife is able to give to the family that she's working with. It's a different model. It's more woman-centered versus, I understand the medical model and the importance of the medical model, given that in the hospital setting, they are responsible for the full spectrum of people with health issues, from low risks to high risks.
Yes.
So the
Very
medical
good
model
point.
is
Very good point.
absolutely important, but what we also have in the midwifery model, coming from the point of pregnancy not being an illness in the first place, not being a pathology, midwifery care is a great option for women to have in hospital setting.
I tell you, ladies, if I would have known, I would have searched. No, honestly, I would have researched my options a lot more, because I love the idea of a village and of a team of women, personally helping out in that manner. And so, but we talked about some more of the realities of childbirth, and we talked about a hospital setting, doulas and midwives and such. But there are birthing centers also. Now that I didn't know. So as an option of a regular hospital setting, you can seek out a birthing center.
Right.
And what are
so-
birthing centers? Nubia, can you tell us about
So
that?
a birthing center is kind of like a happy medium, I guess, between somebody who might want a home birth, but maybe that's not the right setting for them, and a hospital birth. So you have some that are located within hospitals. We have a freestanding birth center in Brooklyn, New York.
Right now, in 2017.
Right now, yes.
Brooklyn Birthing
So
Center.
wait, so we
Yeah.
gotta travel all the way to Brooklyn?
Well, you know
Nothing
what?
wrong, Brooklyn. Straight up, Brooklyn.
Fortunately, more options are now going to be opening up because the birth center bill just passed. So now we're going to have more options where midwives can open and operate their own birth centers.
Now wait, Nubia, this is very important. So now this has literally reached to the steps of Congress and such. Yes,
Correct.
There is a bill that has been passed
Yes.
for birthing centers. Can you tell us, expound
So,
on that?
Prior to this bill being passed, birthing centers.
What is the name of the bill? The
what is that
birth
name of it?
bill.
I think it's on one of our screens back here.
We
the
will
exact
look
name. I
that
don't want to
up.
misquote it, but here
I
it is.
understand.
So that's
There
one
you
of them.
go.
So midwives and birth workers, moms, anybody who wanted to have more options in birth would go up to Albany to lobby for this bill to be passed.
And you went yourself,
I
right?
did go, yes,
Excellent.
with other student midwives from SUNY Downstate.
So you really walk your talk.
Well, yeah, because you want to have moms being able to have more options for where and how they birth. So prior to this bill being passed, midwives couldn't open and operate birth centers on their own. They had to have a physician or a doctor head it, and then they would be underneath. So people would say, okay, what's wrong with that?
Right.
Well, we didn't have any birth centers. We had 2 in all of New York State.
What
the
happened
Brooklyn
to
Birth
those two?
Center, and then we had one up in Buffalo. So years ago, I did some research and found out there was a birth center in Yonkers, and that was headed by a physician who was the husband and a midwife who was the partner, who was his wife.
Okay.
And when they divorced, he shut down the birth center.
No.
So the importance of this bill being passed, midwives will now be able to open and run their own birth centers, so we will have more options for somebody who maybe, you know, can't have a hospital birth, a home birth for whatever reason, or doesn't necessarily want to have a hospital birth. They will have an option of more birth centers being open. And I think that's important going forward, because you need to be able to birth on your own terms. When you kind of take birth
Absolutely.
into your own hands, you're more confident, and there's less unnecessary interventions, less options for C-section. So I think it's important, and I'm really excited that that's where we are right now. Because
Well, congratulations.
Yeah,
That's an
thank you.
incredible victory to have a bill passed, so more options for women are coming into place.
Yes.
I love that. And then
Yeah.
you mentioned something about the C-section. So now that we
Yes.
talked a lot about realities, why don't we get into some of the misconceptions
Right.
about childbirth,
Yeah.
ladies? Because we know that there are a lot of disparities that are, you know, kind of happening. And so, Nubia, can you tell us what are some of the misconceptions about childbirth? And can we focus in on certain areas?
Sure.
Of
So one of the things that I hear a lot just in Yonkers, where I am, from a lot of the moms who come and seek out my services, is that they had a prior C-section and they were told that all their subsequent births then would have to be C-sections.
Wow.
Right. So that's misinformation right there. So the first thing is knowing that there's an option called VBAC, which is a vaginal birth after a C-section.
A VBAC? As in
VBAC.
V.
As
Okay.
in, yes. As in, if you've had a C-section, you can, right, you can have the option to try for a vaginal birth. So telling somebody that all of their subsequent births are going to be C-sections already kind of takes away that choice of, do I want to try?
Absolutely.
Do I want to have a trial of labor to see if I can have a baby vaginally? And in Yonkers, the main hospital where most people birth is St. John's Riverside Hospital, and they have a 50% C-section rate. So that means
50%.
50.
So what kind of information do we dispense in that disparity? Meaning, women now can know that if they have
Right.
had a C-section, they can seek out a doula, maybe, or seek
They
out a
can-
midwife to assist in the second
Right.
birth, because they don't
Right.
necessarily have to have
Not
a C-section with
necessarily.
their
And I
second
mean,
child.
it would be case by case, of course, why they ended up having the
Good
C-section
answer.
in the
Case
first
by
place.
case.
You know, so of course you would have to seek out a medical provider, be it a midwife, be it an OBGYN,
Yes.
who can
Good,
assess,
good.
you know, their individual situation.
Good.
But knowing that VBAC is an option, and that the risk of trying for a VBAC that everyone plants in your head is, oh, uterine rupture. It's less than 1%. But you have other risks if you have repeat C-sections over and over again of, you know, cutting through scar tissue, all these
Placenta
different things
accreta.
that I'm sure all of us, right,
Yes.
can speak to. So I think that big misconception right there is important, that people understand they do have other options. It doesn't mean that all their subsequent births are going to be C-sections, because then there's a limit on how many C-sections you can have. So that ultimately
There's a
limits.
limit. What do you mean there's a limit?
Well, I'm sure, you know, Janice can
Well,
probably
it
speak a
used
little
to
bit.
be that most women were told 3. You know, when I was on the labor floor actively, they were told no more than 3 C-sections should you safely have for to prevent complications. But, excuse me, but we're seeing more and more women coming in with their 4th, their 5th, their 6th section, and then that leads to more complications, more bleeding, different things that can arise and put the mother's health at risk.